Welcome to Warriors Inspiration, the #1 channel for sickle cell motivation. Okay, welcome to Warriors Inspiration. Today I have with me Dr. Blair, and this is always your host, Dr. Hey. And like we all know, this is a channel where we give you warriors inspiration, sickle cell warriors. We inspire you with knowledge and motivation for you to take care of your health, prioritize your health, and live a healthier life. So today we'll be giving you the doctor side of. I'm sure I'm a doctor, so I've given you so many stuff already concerning sickle cell. But today I'll have my colleague here to really go in depth and mention some certain things about sickle cell and warriors concerning sickle cell disease. So, my name is Hey, and this is with me
Dr. Blair.
Dr. Blair.
Yes.
Okay. Kindly like and subscribe.
Yes,
Kindly
please
like
do.
And subscribe.
Please do.
So today, let me just give you an overview.
Okay.
We've done that before, but sickle cell disease is an inheritable disease. You get it from your parents. So if one parent AS genotype and another parent AS genotype, they come together and then they give the SS genotype, because one gene from the parents, father and mother, come together to form the SS genotype. So that's what sickle cell is. Sickle cell happens to be the sickling, that's why it's called sickle cell. The sickling of the red blood cells, and then that causes pain crisis in these individuals. So when the red blood cell cannot move around with oxygen in the body enough, and then it gets to the joint, it gets sickled, and then it causes pain crisis. That's the basics of sickle cell. So let's hear what the doctor has to say about sickle cell.
All right. So first of all, thank you so much for having me in this channel.
Thank you, my pleasure.
It's good to be. It's nice and good to be amongst the warriors. All right. So we're going to be talking about the doctor's view on this. What we would like every sickle cell warrior to know about their health and all of that, and the general public as well as we go on. So the first thing I would want to talk about is prevention.
Okay. Prevention.
So there are different levels of prevention.
Let's start with primary prevention.
Yes. So we'll start with primary prevention. So the first thing is to not to even be in this place in the first place. Do you understand? So it would involve your relationship. It would involve knowing your genotype, first of all. Involve knowing your genotype, and you should do that in at least 2 standard hospitals, do you understand, or diagnostic centers, as the case may be. Very standard and good ones. Reliable ones, yes. To know your genotype even before you say, oh, you want to get married and all of that. And then you should also know the genotype of the person you want to get married to, even before, while still at talking stage. Not even courtship, but talking stage. Like, what's your name? You're interested in somebody, but you're probably AS or your SS. Knowing their genotype before things get too serious and get complicated along the way. Yes, so that is one basic thing. And then this next level of prevention I would want to talk about is, okay, so now this has happened. We've now given birth to a child who is sickle cell, has maybe sickle cell trait, or in general has sickle cell disease, yes. So how do we take it up from there? So number one thing is to diagnose it on time. Do you understand? If you diagnose on time, you would prevent complications, you would live a healthier life. Do you understand? So, and this would, I'm going to be focusing on the parents now, how to know that, oh, this your child, maybe 2-year-old, 3-year-old, 4-year-old, even 6 months old, 1-year-old has sickle cell disease. Number one is you would notice that they always need to be hospitalized and being transfused with blood. The second thing is you notice that this your child, maybe the hands are swollen, the foot are swollen. They call this thing hand and foot syndrome, or that, yes. And then you'd also notice that, oh, maybe their mouths, this part of their mouth is protruded, yes, or maybe their eyes are getting yellow, frequently, and all of that. So these are signs and symptoms that that this is my child, I should get his or her genotype checked in the hospital. Yes. So moving on from that, the child has been diagnosed of sickle cell disease. Another thing to do is to ensure that they manage crisis. We've talked about the fact that they are prone to having crisis, and crisis could be different forms. We have vaso-occlusive, we have hemolytic crisis, and all of that. So the most important thing is to manage this crisis, and you can do that by preventing this crisis from happening. Do you understand? So know your triggers. Your triggers could be anything. Number one could be extremes of temperature. So if a place is too cold or if the place is too hot, it can lead to sickling and can lead to crisis. Do you understand? So if you know that this extremes of temperature causes crisis, you should avoid them by all means. Don't say, oh, you want to be a big boy, you want to be a big girl, you now want to be in a place that has AC and all of that. No. You can have AC, know yourself. Regularize. Yes, regularize and don't make it too cold for you. Yes. So another thing I would also want to talk about is exercises as well. Excessive. Yes. Extreme. Exercise. Yes. So don't say, oh, because my friends are playing football, I also want to play football. That's the in thing. That's how you know that, no. Know yourself, know your limits and all of that. Ensure that you avoid extreme of exercises.
But I do table tennis.
Yes. Yes. So you opt for moderate or mild sports. Do you understand? You can do table tennis, you can do all these table games, chess and all of that. Yes. So these ones are things that can help, These are other alternatives that you can do. Then another thing again is to ensure that you drink lots of water a day. Okay. So the recommended water to take a day is about 3 to 3.5 liters of water. So you ensure that you're always taking your water. Do you understand? You can get a bottle. I think you had this bottle that had
not this one, but then let's drink water.
So he had this bottle that has time frame. You can label that maybe 2 a.m., 2 p.m., 1 p.m., 5 p.m. No, there's that for liters of water that will say, 2 liters of water, 3.5 liters of water. So ensure that you finish that whole bottle in a day. Do you understand? There's another one that would help tell you time as well. Maybe at 4 p.m. you should have taken water up to this level. At 5 p.m. the water should have reduced to this level. Then at 10 p.m. when you're going to bed, you should have finished. Do you understand? So you can get bottles like that. Yes. So another thing to do is to ensure that you avoid emotional stress. Heartbreak.
Breakfast can solve you crisis.
Yes. So avoid them. The way you can avoid them is that this person has a tendency, this person is not your type, or this person has a tendency to break your heart from the onset of the relationship. Ensure you choose wisely. That's another thing.
This is not just emotionally intelligent.
Yes. So ensure that you are hooked up with somebody who is emotionally intelligent and who is ready for a relationship. Do you understand? To avoid heartbreak. These things you cannot really predict that this person would eventually break your heart from the onset of the relationship, but as much as possible, ensure that you do your own side of the job. Do you understand? By choosing wisely. So another thing is to take your routine drugs, folic acid and proguanil or paludrin. Yes, ensure you take your routine drugs every time, and I'm sure that with that you will be able to manage crisis as much as possible.
Thank you.
Yes. So yes. So trying to avoid complications.
Okay. How to manage complications?
Yes, manage complications and avoid them from even becoming worse and all of that. So the thing I want to talk about is to ensure that you are always keeping up with your clinic visits. So your doctors are the ones that can.
I am a victim, or how I call it, I'm a culprit.
My God. So the thing you have to do is to go to your doctors. They are the ones that will dictate if you're going to have a complication on time or not, and know how to avoid it. or stop it from progressing. Do you understand? So we've talked about different complications on the channel: stroke, leg ulcer, avascular necrosis. You know, there are different kinds of complications. So you should ensure that you're always keeping up with your doctor's appointment, so that you would not get into this web of complications and degenerating conditions. Yes. So another thing I would want to also talk about is to just basically address the general public to know that people living with sickle cell disease, they can live a normal life. You don't have to segregate them. You don't have to stigmatize them. That's the word. Yes. They can live a normal life. They can be doctors, you know, they can be lawyers, they can be engineers, they can be the president of the nation. You know, they can live a normal life, a close to near normal life. You know, once you're sure that you do all of these things that you're supposed to do, you manage your crisis, you pay attention to your health as well. You know, they can live for long years. Do you understand? Yes. So another thing I would also want to talk about is your faith as well.
The X factor.
Yes.
There is the Christ or Jesus factor, or it could be a Muslim. You have to just, you know, involve the God figure that is in your life into this. And then for me, I'm a Christian and we are both Christians. This is a Christian channel. I would say God is amazing when it comes to taking care of your health.
Yeah.
I have less frequent crises, way less. And I'm sure it's because of the prayers I've had. I'm sure it's because of the fact that my mother and my father have prayed for me. And you know, we now after doing the medically appropriate thing,
yes,
then you ensure that God is involved.
Definitely.
You know, make sure you're
healthy. You pray, and there's a verse of the scripture that says that I wish above all things that thou mayest prosper and be in good health. Yes, so that promise is also for you as well. God wants you to also be in good health. So I hope that with this point of, oh yes, I also forgot to mention that whenever you're having crisis, you know, ensure you get to a doctor. Just go to the hospital.
Don't self-medicate.
Don't self-medicate, because there are some medications that can cause more damage in the long run.
Yes.
Do you understand? So your doctors,
like you mentioned.
Yes. So your doctors would know the particular medication that they would give to you, you know, to control your crisis, dependent on how severe those crises are. Do you understand? So ensure that you always go to the hospital and get proper treatment.
Thank you. It was amazing having Dr. Blair here.
Thank you very much.
I still remain your host, Dr. Hayford.
Yes.
Thank you for watching. Kindly like, subscribe, and comment. Thank you.
Yes. All right. Thank you so much for having me. All right. Bye, guys.